Hey, Dr. Desman here. I wanted to shoot you a quick video for your post-op instructions after your rhinoplasty. We should have given you some printed instructions in your folder from the office that Olga gave you, and you should also have gotten some printed instructions from the recovery room in the surgery center. And I figured this is just a quick way, almost like a quick cheat sheet for you for some post-op instructions for the rhinoplasty as well. Taking care of yourself after the surgery is pretty simple and straightforward, but if you have any questions at any time, just give us a call, 703-924-3144. First thing is you should have your first and possibly second post-op appointments already scheduled. And if you don't, please call first thing in the morning, if it's after hours when you're looking at this, to get that first post-op appointment scheduled as soon as possible. Or call as soon as possible to get that first post-op appointment scheduled. We sent in prescription for pain medicine as well as for antibiotics for you already. Hopefully you've picked them up and you can start taking them within 2 hours of coming home from the procedure. Now, as far as what you need to do to take care of yourself, it's really pretty straightforward. First thing is I don't want you laying flat. That's going to increase your swelling, so you want to even sleep with your head elevated. Some people have lounge chairs that they sleep in, but if nothing else, just 2 or 3 pillows will be enough to kind of keep your head elevated and help decrease the swelling. You want to use ice fairly frequently in the first 48 to 72 hours. I have some patients who even use ice into the first whole week. And really you want to do kind of 20 minutes on, 20 minutes off. Some patients find that getting 2 bags of like frozen peas or frozen corn and swapping them out and alternating them works real well because they kind of change and mold and conform. That's just an old trick that can help with the recovery and icing things down. The only other thing that you really need to do is to occasionally change the pad that's at the bottom of your nose sitting right there, and that's what's called a drip pad, and it's there to catch any fluid or blood that drips out of your nose. It's pretty straightforward. If that gets soiled, you want to put a fresh gauze pad there. And that's really it for taking care of yourself after your rhinoplasty. Keep your head elevated, ice frequently, change your drip pad, and that's going to take you a long way. Take your pain medicines, and then of course, give us a call if you have any questions or problems. Doesn't matter if it's 3 o'clock in the morning. I am available. May take a couple of calls from the answering service to wake me up if it's 3 o'clock in the morning, but just be persistent and I will get back to you. Don't hesitate to call, and we'll see you soon for your first post-op appointment.